5 years ago, my mother was diagnosed with multiple sclerosis, also known as MS.
I was pretty devastated when I was diagnosed. The thought of my body at war with itself was very difficult to accept. I hope one day science will find a cure for MS.
MS is an inflammatory disease in which the insulating covers of nerve cells in the brain and spinal cord are damaged by the body's own immune system.
The name multiple sclerosis refers to scars also known as plaques or lesions in the white matter of the brain and spinal cord. Currently, there is no cure. There are only medicines to slow or halt the progression of the disease.
MS was first documented in 1838 by Jean-Martin Charcot and was completely baffled by its cause and frustrated by its resistance to treatment. Over the next 150 years, progress was slowly made to identify the cause of the disease, and with this information, treatments to slow the disease progress came to beginning.
The first drug, beta interferon 1B, used to treat MS was introduced in 1993. It was quickly followed by several other drugs of the next decade. All of these drugs were the first to treat the disease and not just treat the symptoms. In Incade, what started out as an untreatable disease suddenly had 6 new drugs.
Most of the earlier drugs were injected either by a patient or in a hospital. Within the last few years, several medicines have been discovered that can be taken in pill form. These new drugs eliminated the need for daily injections, greatly increasing the people with MS quality of life.
When my mom first started taking medicine to help her with multiple sclerosis, she had to manually inject the medicine in her belly. An automatic pen type injector was introduced, which made the injections a little easier. The medicine in the injections caused her a lot of pain and sometimes made her very sick. She now takes a pill, and so, for her and others, injections would be a thing of the past.
Everyday scientists are making breakthroughs which will help lead to ways to prevent, treat, and cure many diseases. Without these breakthroughs, life would be very different and difficult for people all around the world.